Hi, my name is Garvin, and today I'm going to give a presentation on deaf and hard of hearing. So to start off, what is the difference between the two? So deaf refers to an individual who has very little to no functional hearing. This person often uses sign language, and they can also use lip reading. Then you have what's known as hard of hearing, which refers to an individual that has mild to profound hearing loss. This person uses sign language, spoken language, lip reading, or any kind of combination of that sort. So you have categories of deafness. You have three different categories. So you have what's known as conductive deafness, which is physical abnormalities in the outer or the middle ear. And this is when sound cannot pass efficiently through the outer and middle ear to the cochlea and the auditory nerve. This is mostly caused by fluid building up inside the middle ear, or it could be from an extensive amount of earwax inside the outer ear. So then you have what's known as sensorineural deafness, which is abnormality in the inner ear. Right here, this is mainly caused by a problem in the cochlea, and it's caused because of normally the hair cells inside the cochlea do not work properly, and they don't transfer the sound waves efficiently to the vestibular nerve. And this type is actually mainly permanent. And then you have what's known as mixed deafness, which is a combination of conductive and sensorineural. So now we're going to get into a little bit of anatomy of the ear. So we're going to discuss how it works. How do you hear? So you have sound in the atmosphere that comes and strikes the auricle, which is then directed into the external acoustic canal or meatus, which these sound vibrations then strike the tympanic membrane, which is your eardrum, which causes it to vibrate. And the vibrations from the sound waves are then sent to these three bones in your ear right here, your malleus, incus, and stapes, and these amplify the sound and then transfer that to the cochlea, which is fluid filled, and it's inside the inner ear. So here's the anatomy of the cochlea. So you have an elastic partition that runs from the beginning to the end of the cochlea, which splits it into an upper and lower part. So this would be it right here. This would be the elastic partition that splits it all the way through. So once the vibrations, or actually this partition is called the basilar membrane. So once the vibrations cause the fluid inside the cochlea to ripple, a traveling wave forms along the basilar membrane, which you have little sensory cells that sit on the basilar membrane, which are known as hair cells, then ride the wave that the vibrations form. These hairs located near the wide end of the cochlea detect the high-pitched sounds, as well as the ones closer to the inside, or the center, detect low-pitched sounds. These thousands of tiny hairs help translate the sound vibrations into electrical signals, and the auditory nerve or cochlear nerve then carries these electrical signals to the brain, which turns sound that we recognize and understand. So what causes someone to be deaf? So there are many different reasons why. This one right here, damage to the inner ear, is the most popular or the most common. This can be anything from having loud noises or explosions go off in your ear, and these cause damage to those hairs or nerve cells in the cochlea, so those electrical signals are not transferred efficiently. This can happen from anything like a work concert or a music concert or a workplace, or any kind of like loud banging noise. And then also could be from aging, which would be more genetic. Then you have abnormal bone growth or tumors. So you have your ossicles; they could grow too large or maybe harden so they don't vibrate correctly. And then you have what's known as cholesteatoma, which is actually a tumor of the middle ear. And then to go along with damage to the inner ear, you have a ruptured tympanic membrane. And these could be from loud noises, sudden pressure changes, so anything like in a plane when you go really high up or really low in the ocean, like a submarine, you get pressure changes, well, they can rupture your eardrum. And then you can get anything such as poking an eardrum with an object. which like a lot of people use Q-tips to clean out earwax, but they got to be careful because they could also rupture their eardrum. And then you have things like hereditary, which is just genetic and makes you more susceptible to hearing loss. Occupational noises, again, so jobs that have loud work environments, such as construction or factory work. You can also have some medications, antibiotic, gentamicin, and some other chemotherapy drugs. And then you even have some illnesses, so things like meningitis, measles, bumps, and rubella normally lead to deaf and hard of hearing. And these are normally contracted as in your childhood. So that's what a lot of common deaf and hard of hearing happens in children or from these in childhood. And then you have things such as trauma and head injuries. So on this side we have different sound levels and their common noises. So as you can see over here, you have what's known as a safe range. And here's your decibels over here. So this is the decibels anywhere from 30 to 78 would be your safe range, and that's anything from a whisper to light machine washing or normal conversation. And then you have your risk range, so anywhere from 80 to 110 decibels, and these are things that are loud or like heavy traffic, motorcycle, again a rock concert. And then you have things like your injury range, which is anything from 120 to 180 decibels, and this is things like an ambulance, sirens, a jet engine takeoff, or even a rocket launch. So definitely don't want to sit around a rocket launch for too long. So here you actually have levels of hearing loss. So there's different stages of hearing loss. So your normal hearing, people normally experience 0 to 25 decibels, and again that's considered normal. Then you have mild hearing loss, which is anything from 26 to 40 decibels, and that's difficulty hearing soft speech, so like whispering. Then there's moderate hearing loss, so anything from 41 to 70 decibels, and that's difficulty hearing moderate speech when background noise is present. Then you have severe hearing loss, again 71 to 90 decibels, that's hearing loud speech, but you can hear it if amplified, so things like hearing aids would work. And then you have what's known as profound hearing loss, which is 91 decibels or more, and that's difficulty hearing or understanding even with a hearing aid. So out of all deaf and hard of hearing, 70% of hearing aid users fall between mild and moderate range, and 30 of those users fall between severe and profound. So here are some kind of symptoms that deaf and hard of hearing people normally have, and that's usually muffled speech, difficulty understanding words, especially background noise, trouble hearing consonants, frequently asking questions, needing to turn a volume on the TV, again withdrawal from conversation because they feel like they can't participate in it, and even avoidance of social settings because of their deafness illness. So then you have effects on deaf and hard of hearing on exercise. Now I wouldn't say that deaf and hard of hearing directly affects exercise to the point where they can't do a movement such as like a lifting or anything. It's more so like the environment that they're in affects them. So again, any kind of communication with employees or others, they might not be able to understand what's going on or how to talk to somebody. Or communicate properly in the setting, and these people, you gotta have patience with them and a way to properly communicate. So anything like using a tablet or some kind of like translator to write things down. And then things like room acoustics. So any kind of like poor room acoustics can make understanding the conversation very difficult. So if they're dealing with like a personal trainer, any kind of loud music, weight slamming, and like fans could affect them being able to hear and talk. And then I found something interesting called perilymphatic fistula, which is actually happens from exercise, and you can rupture the membrane of the inner ear due to pressure changes from strenuous exercises, and this actually causes fluid to leak inside the middle ear, and these can be done from anything like strenuous exercises like CrossFit or extreme yoga. So that can actually cause someone to have a hearing issue, but it also doesn't help if someone already has a hearing issue. This could make it worse. So are there any managements and cures? So one of the most common for like the most severe or profound people with hearing aid issues are cochlear implants, and these are surgically implanted hearing aids. And you can see here on this diagram, I have a picture of it. Then people can use visual aids such as, again, translators, any kind of signs, a notebook, things to write things down. Then you have behind the ear hearing aids, which right here is like the most common one that people use. And then you have things that they use such as lip reading and even sign language. So now we're going to get into the case study. So we have Jonathan, who is a 36-year-old male who's hard of hearing. He's 6 foot and 190 pounds. His blood pressure is 126/70, and he's an active individual that enjoys swimming as well as hiking. He performs these activities 2 to 3 days a week, depending on his availability. His mother is also deaf, and he was diagnosed at the age of 3 after having meningitis. He has no history of high cholesterol, and his dad passed away at 56 from a heart attack, and he used to swim competitively in college. Some of his goals: he wants to live a healthy lifestyle, he wants to put on more muscle and gain strength because he's interested in a resistance program, and he wants to improve the quality of his life. So moving on to his risk stratification, I listed a couple things here, so actually positive things. So he's active for the most part, he works out 2 to 3 days a week, doing cardio. He's good blood pressure, good cholesterol, and his dad died from a heart attack at 56. So this is the only negative one I have on here, but we would place him in the low risk category because even though his dad died of a heart attack, if we look at the risk stratification guidelines, it's someone who's 55 or younger as a father, so he would be okay from that. So different exercise testing. We're going to have him do a 1 rep max bench press, a 1 rep max squat, and a 1 rep max deadlift because, again, he wants to work on a resistance program and wants to focus mainly on gaining muscle and strength. So moving on to the exercise prescription, we have resistance training. We're going to do 3 to 6 days a week, an intensity of 60-80%, 1 rep max, 8 to 12 reps, 6 different exercises targeting major muscle groups. Any kind of compound movements such as a bench press, a squat, deadlift. Then we're going to work on his aerobic training. We're going to do 2 to 3 days a week, 40 to 60% VO2 max, 30 minutes to 1 hour a day. And since he already likes swimming and hiking and he does that frequently, we're going to have him continue doing that. So moving on, we're going to do flexibility, frequency 2 to 3 days per week. Hold the stretch until tension is felt without having discomfort. 15 to 60 seconds, 3 to 5 sets. Definitely going to do dynamic before each workout that he's doing, and then we're going to have him do static after a workout. Balance, he's pretty healthy. I would say wouldn't have to focus too crazy on that. So we're going to do 2 days a week, strenuous enough not to fall over. 3 to 4 exercises and 2 to 3 sets each, and actually a lot of these can be incorporated into his actual work exercise planning he's doing now. So any kind of engaging core throughout all his exercises, single leg deadlifts, 1 leg squat, and Bosu squats, and that would be incorporated once he starts to get a little bit more better into his exercise program. So here I have like a weekly example of like a workout for him. So this would be like an like an early week 1 thing. I have him lifting 3 days a week and doing cardio 2 days a week. Actually 3 because he has a hiking, and that's more like a leisure on his off day with 2 days. And then any kind of final thoughts. So this is more for us as exercise professionals. So dealing with deaf and hard of hearing doesn't mean they actually affects a person's ability to perform the exercises. They're just going to have a harder time communicating. So again, have a safe and functional environment for them to be in. Have clear communication, write things down so they can visualize it, demonstrate things, make sure they can understand it properly. Look directly at them and speak slowly if they read lips. Maybe even learn some sign language, and definitely have patience. And here's my citations. So thank you.